COVID-19. Some good news came out of the African continent. The World Health Organization declared the 10th Ebola outbreak in the Democratic Republic of Congo over, but warned especially against flare-ups and urged support for survivors to continue. That's something many countries would love to hear about the coronavirus, but the reality shows that the pandemic is here for a while yet. So to dissect Africa's response to the pandemic, we're joined by Dr. Mary Stephen, Technical Officer at the World Health Organization's Regional Office for Africa. Dr. Stevens, a very good evening to you, and thank you so much for speaking to us. So that announcement being made on Thursday and certainly being a relief on the health systems of the Democratic Republic of Congo, but they certainly have learned lessons from this that other African countries can glean from in dealing with COVID-19. What would the WHO say that should be?
Yes, thank you, and good evening to your viewers. Ebola, the 10th outbreak of Ebola was declared over, and yes, we have learned a lot of lessons. And one of those lessons is engagement of the community from the beginning of the outbreak, because they have a big role to play in the control of any type of outbreak, not just Ebola, but any type of outbreak. So when the community is engaged from the very beginning, it is likely that they will adhere to all the measures that are being suggested to be observed by the general community, by the government, and this will go a long way in helping to curb further spread of an outbreak.
And just speaking of health systems, looking at South Africa, we're seeing an increase in transmissions of COVID-19. And there are some countries on the continent who are worse off in terms of their health system. So this is a huge danger if there is a surge that is expected. There was concern about the cold weather upon the African continent. From the WHO perspective, is there concern that even though there have been lessons learned from the Western or Northern countries, that we may actually suffer that fate of collapsing or weakened health systems?
Yes, the health system in Africa, we know, is not as strong as what you find in other parts of the world. But we have seen what countries have put in place for the COVID response, especially the countries that we see locally, countries reporting the highest number of cases are those countries where the health system is much more stronger compared to other countries on the continent. And of course, those are the countries with much more resources as well on the continent. So we have seen a great effort put in place by all the governments of these countries in Africa, but what we need to make sure is that we are implementing these measures of early detection, testing, isolation, contact tracing, and treatment of these patients in a sustained manner. So we need to continue to sustain the effort. Where we need to expand, we need to expand. Yes, there are different issues, of course, with regards to weather, but we know that the COVID outbreak, basically we are able to slow down the progression by implementation of these recommended public health measures, including what we talked about for the Ebola in DRC, engaging the community to make sure that they are implementing the preventive measures of keeping their distance away, making sure they wear their face masks, washing their hands, observing respiratory etiquette, so that we put both the government effort and the effort of the community together to help reduce the spread of the outbreak.
So I'm glad you mentioned that, Dr. Stephen, because we've been showing a map of the countries with the highest transmissions, and that would be in West Africa. We saw Nigeria, we saw Ghana, with South Africa obviously being at the top of that list as well. But we've also seen countries that have low transmission. Now, with regards to community transmissions, the criticism has been that there's been low adherence to physical distancing. You spoke about the communities being able to adhere to these guidelines, but in some cases we know that people say they don't really have a choice if they're going to live or their living conditions. So what have you learned just from the trends in Africa on community transmissions. Is population density the reason for why we're seeing these escalations?
Yes, in Africa, the context is definitely different from where from the rest of the world. Of course, we have our peculiarities. The population is there. The way we live as a community is also a challenge. But it doesn't mean that we should give up and that there is nothing we can do about it. Yes, there is something we can do. We have responded to big, challenging outbreaks before in Africa, despite the challenging context we have. And yes, we have every role. Sometimes even the community themselves, they can actually provide you, if you engage them, they can actually provide you with some ideas that might work in those difficult contexts that you as a professional has not even thought about it. So this is why we need to engage them and also adapt according to the context. So if for instance, in a community where people are not able to manage a COVID case, for instance, at home, we need to provide that alternative for them to be isolated elsewhere, because we have seen a lot of government now beginning to think of these mild cases to decongest the hospital. They want to send them to be managed at home. But in Africa, we need to do it carefully and providing alternatives for people that cannot or are unable to do that. We need to make sure we have temporary facilities where we can keep them. And where a community is not able to keep the 1 meter distance, for instance, at least they can wear their face masks, at least they can wash their hands, or they can use hand sanitizer. So let's not give up. There is always something we can do despite the challenging context.
And I'm glad you mentioned that, because a country like Ethiopia, for instance, having demonstrated that community healthcare is sometimes much better than public healthcare. So this is a lesson that we can learn as a continent. How does South Africa set that example, given the fact that we've seen a huge increase in cases and the management level thereof has been lauded by the World Health Organization? So countries like the Gambia, who have lower cases, how could they learn from this? There's no antiviral treatment in sometimes highly impoverished communities. What can community healthcare do to support this?
Yes, so like I said earlier, all members of the community, all of us, we all have a role to play in terms of responding and preventing further spread of this COVID outbreak. So we need to make sure as individuals we are taking personal responsibility, and of course the community. We saw how it works also in Eritrea, making sure that everyone is engaged from the beginning of the outbreak, because we know this virus is spreading as a result of human interactions. So if the community, if they are empowered, they know exactly how this virus is spread, they will take it a bit much more serious if you engage them to make sure that they are taking personal responsibility to prevent themselves from being exposed to this COVID-19. So yes, we need the government, we need the community, we need everyone, the private sector, we need all hands on deck to make sure that we are limiting the spread of this outbreak.
Finally, Dr. Stephen, I'd like to find out, with the treatment, with regards to the treatment of adults and children, obviously, as you say, we're still learning a lot about COVID-19. What can we do as a continent in getting ahead of some of the trends that we're seeing, that even though there's been no identified mutation, but there is a scientific behavioral change in COVID-19, and the issue of using traditional or organic medication or plant treatment? What can we to get ahead of the curve, strengthen people's health systems, own health systems, while we strengthen the public health systems?
Okay, so for COVID-19, right now there is still no specific treatment for COVID-19, and there is no specific vaccine for COVID-19. So what we need to do as government, as an individual, making sure that we are expanding this capacity to detect, to isolate, to test, and contact trace all the contacts of confirmed case, and also provide treatment for those that are sick. Decentralizing this capacity as we continue to see increasing number of cases across all the different levels of the health system, to the district level, to the community level. We need to make sure that we have these capacities decentralized to the lowest level of the health system. Secondly, we need to make sure that the community is engaged as much as possible. We need to continue to engage them where possible, get the religious leaders, the community leaders, so they can also talk to the people, because these are people that are respected so much in the community, so that everyone will take personal responsibility to make sure they are not being exposed. And as government, we also need to continue to expand on the capacities for a potential increase in number of cases, so that if we have additional cases, we are still able to respond while maintaining the availability of essential health services to cater for other health conditions that we have in Africa.
Thank you, Dr.
As a whole, sustaining and maintaining these public health measures is very, very important, with personal responsibility from the community.
Thank you so much, Dr. Stephen. Dr. Mary Stephen is the technical officer at the World Health Organization's Regional Office for Africa. Let's take a look at your headlines.